Good afternoon. Welcome to OET Medical Videos. This is the second series of the writing videos entitled How to Pass the Writing Test with me, Trevor Gordon from OET Medical. This is our website homepage, and what we're going to look at immediately is we're going to look at the new sections for scoring, because these have changed. So the way that they're going to mark your letter now is with these sections: purpose, content, conciseness, genre and style, organization and language. We're going to go through those. Just some information here at the beginning. Those numbers you see to the right are the range of scoring that you can receive for each section. So these are the criteria that the examiners use to assess your essay. For each section, scores range from 0 to 3 for the first one, purpose, and the other ones are 0 to 7. To receive a B or C, you need to score at least 2 out of 3 for your purpose, and between 5 and 7 for your other components. So you need to get at least 2 out of 3 and 5 out of 7 for these. So we're going to go through these one by one, and each part of it will have a couple of slides. Some will have 2, some will have 3. So just bear with me as we walk through each section. So the first is the purpose. This covers the main focus of the letter. Why are we writing it? When you write, you will have a purpose and a person to inform, to write to. Excuse me. This will be covered in this section. When commencing the letter, the purpose needs to be apparent quickly. The reader needs to know what the letter is about at the earliest possible stage. Excuse me, sorry. Mr. Baker is being discharged from City Hospital back into your care today. He underwent a left total hip replacement. So the reader of this knows who the person is, what's happening. They're being discharged from the hospital, and the important thing, back into your care. So it could, in this case, the letter is actually to a care home. He underwent a total left total hip replacement. So this is a kind of thing that you would introduce so the reader knows exactly what the purpose of the letter is. Click on the link below. So below this video, in the section, writing section, or the section for comments, etc., and title, you will see a link that will open the letter that we're using for this example. So the second purpose, part B. So in this part of the letter, we provide the information which is associated with the purpose of the letter. This is to expand the information and provide further relevant information. We have to introduce the patient's patient circumstances. So we're saying in this section here why the patient had this operation. So Mr. Baker had an elective total hip replacement operation due to increased difficulty moving and climbing the stairs in his home, in conjunction with increasing osteoarthritis. His mobility is good and he uses a walker with no difficulty. So we've said why he's had the operation, and kind of we're just summing up what the result of the operation is. So what the patient underwent, why, current condition or results of treatment. That's a good format to follow. You might not need everything there, but you will need most of them. So as it says, this is a good model to follow. But do remember, each case is different. Moving on, actually, just another point regarding that last statement. Many students are being given templates to follow for the structure, and as a result they don't write in the flow of the information. If you're given a template, the template will never change. It says write this first, then write this, then write this, then write this. You should look at the information you're being given. It might need to be written in a different order, so don't be caught out by this template thing. Templates can help you, but they can't help you when you have to look for the information and decide which order that information should be in. So please be aware of this. Content. Content is about knowing who you're writing to. The information you provide to that person must be relevant for them to do their job. Also, only include relevant information and do not include non-relevant information. Pretty obvious, but we have to state it. So, using the information given in the task notes or case notes, write a letter to Miss Samantha Bruin, senior nurse at Grey Walls Nursing Home, who will be responsible for Mr. Baker's continued care at the nursing home. So we're going to write to Miss Samantha Bruin, the senior nurse at the nursing home. She will be probably receiving the patient back from the hospital, so she needs information so she can do her job, or the nursing home can continue with his care. So that's all the information they need. What do I need to continue this patient's care? So the person we need to focus on is the person indicated in the task and their role. So we select contents from the notes which is relevant to that person. They need to be able to use that content to continue the process or the care. Okay, the next part of the letter is the content. The content of the letter should cover what is going to be needed to continue with the care of the patient. So the most vital information not relevant, and no relevant details missing. So the person who's going to look after the patient, take the next step in the patient's treatment, care, whatever, needs to have the relevant information to be able to do that. So here's an example we've taken from our sample letter. After his operation, Mr. Baker was restarted on his post-operative 100 milligrams of aspirin on a daily basis. Restarted is the key. So he was on it before, he was taken off it possibly for the operation, he's being restarted. So that tells me that he's on that medication. He's also being treated for hypertension, which will continue. If he's in a care home, they may have that information already, but you're not sure, so you give it. Additional treatment will be in the form of Panadyne Forte, max 8 tablets a day. So this is additional treatment, so this will not be anything that the care home knows about. And daily changing of the dressings. Obviously, with his operation, he has some dressings. Now, these things need to be done in order to continue the treatment. So this is what you've got to give the person receiving your letter. He will also need to undergo a course of motion range, stretching, and strength increase exercise routines, in addition to occupational therapy to aid complete recovery. So he also needs these things. All this information will be in the letter, so you don't have to pick it out of thin air. It's in the notes for the letter. We'll also need to look at the discharge plan, because when someone is being discharged, there will be part of the notes that signify a discharge plan. And it will tell you what that discharge discharge plan is in the notes. So we will provide a walker wedge pillow for him, along with the hire of a toilet razor for 2 weeks, which our social worker will arrange. So these things need to be done to continue the treatment. We've also put in there that the social worker will arrange some things, because that will be in the notes. Remember, you can only write what is in the notes. If it's not in the notes, don't include it. Don't guess it. Don't think, well, this is what I would do. Don't use the notes. You'll only be judged on the notes that are there and how you've interpreted them. So do not, please, put your own conclusions in there. The next section covers conciseness and clarity. This section covers the length of the letter. What you include or don't include in the letter will determine its length. Less than 80 words might indicate that you've missed something. More than 200 words may indicate that you've provided some non-relative information, or your sentences are just too long, or you're over-explaining. One thing you shouldn't do is over-explain. Keep your language simple, concise, relevant to the task that you're doing. So, for example, here's some note. Post-operative disorientation for time and place during recovery, possibly relating to anaesthetic. Continued observation recommended. This is the note form. So this will be translated, or expanded, should I say, into: while in post-operation recovery, the patient displayed signs of disorientation, which could be connected to the effects of the anaesthetic. Continued observation of the patient is advised. So there we have a coherent English sentence taken from the notes and converted into proper English, if you want to call it that. Okay. So again, conciseness and clarity. The information is clearly written and presented in a logical format and order. That's very important. So going through the sections that we've already looked at, we've got in green, the patient's being discharged. In red, it tells us why the patient was in the hospital and what treatment he had. And the next in purple is just a kind of current status. So this is what's happening to the patient. This is why he was in the hospital, and this is his condition now. Okay, so we're adding some notes here as well. After his operation, Mr. Baker was placed on post-operative 100 milligram of aspirin, etc. He is also being treated for hypertension, which will continue. These are the things that we put in there that the person who's reading the letter should know. So we see the logical presentation of the information in sequence. What is happening to the patient, what treatment given and why, the condition of the patient now, the treatment provided immediately after his operation. So sequencing and a logical format go a long way to the letter being easy to read. This is the main objective. The person reading it should find it easy to read and understand. And of course it has to be within the word structure of 180 to 220 words. So next we look at genre and style. Your writing must maintain a clinical style and contain facts only. So in this example we're looking at 3 things: preserve skin integrity, continue exercise program, equipment required, wheelie walker, wedge pillow, toilet razor. Now, preserve skin integrity as the patient is conscious of scars or blemishes. Also, to stop the patient from becoming lazy, he must continue his exercise program. He also has trouble with incontinence, so is being provided with a toilet razor to allow him quicker access. Now, here the writer is giving their own opinion of the patient, which they should never do. We don't know if the patient is conscious of blemishes or lazy or has problems going to the bathroom. This is maybe what the writer is assuming, but if that information is not there, don't add it. You should be sticking only to the facts. We write purely from the notes provided, and we do not use your prior experience to assume something. Now, you're a professional. You work in this environment. You would say, oh, that's caused by this. But you can't do that. You've only got to write what the notes tell you and nothing else. So that's very important to remember. As a teacher, I have written letters and asked my students, well, where does this come from? And the answer has actually been, well, I've seen this before in other patients in my job. So no, do not do this. It's very important to just stick to the information that you have been given. Okay, going back to genre and style again. This also applies to the tone you use with the recipient of the letter. The person reading the letter will be a specialist. So you need to be professional in your advice or request. Don't tell the specialist what they should do or what you think they should do. Yes? I think you should do this. Don't forget to do this. A definite no-no. You can make suggestions that you think would aid the situation or would help the patient. Use language which suggests or points out things you see or have observed. I've noticed that the patient is blah blah blah, maybe we could do this, or I would like to point out something that I have observed or noticed. It means the same thing. But if you feel that you want to give some additional information that you've noticed, then put it in a form, but you're not telling the specialist what to do. They know their job. Okay. Another thing to note is technical terms. Only used widely or universally recognized terms and abbreviations. For example, if you use a term in your country, would someone from another country recognize it? If they don't, or if they won't, don't use it. Again, the last thing here is tone. Always use a professional tone, even if you know the person you're writing to. It could be a colleague of yours, but you should still keep the tone professional. You are a professional. Doesn't matter if that person is your best friend. You should still maintain that, because these notes are kept. A lot of the information is kept and may be looked at in the future. So you want to maintain that tone. And the last thing here is we have organisation. Let's look at the overall presentation of the letter. We'll go to the letter is an example of the letter is there for you to see. So the person you're writing to with the relevant title, address, etc. That information will be at the top of the letter, but there are plenty of forms of this, so you'll see this many times while you're practicing. That will become easy. As a suggestion, you should practice writing the address, information, and introduction information. So the name of the person, their address, dear sir, RE patient name. Practice writing that. The quicker that you can write that, the more you can focus your time on actually the content of the letter, because that never really changes. There will always be the address, the name of the patient, and the name of the person you're writing to. That's always there. Make sure each paragraph relates to a different topic and is separate within the letter. Don't join ideas together. So for example, Don't put his discharge plan in with his treatment. Keep them separate. The patient had this, a treatment A, B, C, D, blah, blah, blah. Then go to a new paragraph. As part of his discharge, the patient needs to have blah, blah, blah. That will be a separate paragraph. One is about treatment, one is about the discharge. Keep each one separate. That is a general rule. Doesn't matter if there are only 2 or 3 lines or 1 or 2 lines about this topic. If you're starting a different aspect or topic of the letter, put it in a new paragraph. The person you're writing to must be thought of throughout the writing of the letter. Okay, so these things are things you're going to practice while you're doing your letters, but these are the new criteria to outline the letter. So again, if you'd like to practice with us, we can give you plenty of letters. We have plenty of letters of all different aspects, and we can walk you through the practice, the organisation, and of course the English that you need to write a competent, successful letter. Okay, well, thank you for your time, and if you would like some more information, visit our website, oetmedical.co.uk. We also have a YouTube channel which is called OET Medical, so take a look there. We're constantly populating it with videos. We would like to have your feedback. Tell us what you want, tell us what's good, tell us what's not good, tell us what's not useful to you. So with your help, we can tailor our YouTube channel and our website to suit you. So thank you for your time, and see you in the next video.